I got a notification that the recording's in progress. Did you guys get
So
that?
I sure did.
Yes.
We are recording.
It was very ominous and Big Brotherish. Like I almost wanted to reply, like you haven't been recording this whole time, right?
Yeah.
Hey, thank you guys for joining us. I know this is kind of a special video that we're doing, so why don't I'll kind of introduce myself. I'll kind of talk just for a minute about what we're doing and kind of the point of the video, and then I'll let my guests introduce themselves, and then we're gonna hopefully just have some good old conversation about some things. So my name's Derek. I'm a licensed mental health and addiction treatment provider here in Oklahoma City. I've got a small private practice that I run. And in addition to that, I've got the privilege of hosting some of Parents Helping Parents online content. If you're not familiar with Parents Helping Parents, they're a local nonprofit agency here in Oklahoma City that has a mission of helping support parents through education, shared experiences, and resources for families and parents who have somebody that's struggling with a substance use disorder, or a child specifically that's struggling with a substance use disorder. So you can look up more information about them. That's not the purpose of this video, but I think it would be great if you wanted to check them out. Their website is www.parentshelpingparents.info, or you can check them out on social media at Parents Helping Parents Inc. The short story is they host support groups for families in various places across the metro area and in Oklahoma, including Tulsa, that Oklahoma City Metro, Tulsa Metro, where they offer support groups for those families who might need it and might be struggling. Fantastic organization. They have asked us to get a couple people together and have a conversation about the pandemic and about COVID and about community and mental health and recovery and all of those things. And so that's kind of the purpose of why we're here today. So I'm kind of excited. I think anytime I get a chance to sit down with these two lovely people, I know that I'm not going to have a bad time. So at least I'm going to have a little bit of fun and probably laugh a little bit. So why don't I let you guys introduce yourself, and then we'll just kind of go from there.
Ladies first.
Teresa Stephenson, and I'm not representing my agency, but I do work for the Oklahoma Department of Mental Health and Substance Abuse Services, and I've been there around 16 years. I've been in the field for over 20 years, working with individuals that have substance use and co-occurring disorders, and so that's kind of why I'm here.
Teresa really shortchanged herself. Her wealth of knowledge and experience in the field is, I think, much greater than that simple and humble introduction. So Teresa, I'm really glad you're here. I know you're going to have a lot to offer our conversation.
Okay.
I'm Geoff Hoover. I'm a primary care physician. I work for Mercy Hospital. I've been with Mercy since 2010. I've been in Oklahoma as a physician since 2003 in the Oklahoma City, Edmond area. And so I mainly are seeing people on an outpatient basis all through the pandemic. But I did actually do a short stint in the inpatient facility when we were kind of pre-vaccine and really needed some people. So got to see, some things firsthand with regard to the way the pandemic affected healthcare workers, as well as just people in the community who would seek medical care.
Yeah, man, you guys are just you're both so humble, which is why I love you as people. Geoff had also just a great, man, can I call you a humanitarian? Is that an overreach? Because you do so much like for the community in terms of volunteer work and your involvement at the clinic that you work at on the South Side and all of those things. And so I'm just gonna say this: Geoff is a qualified physician who really cares about his community and puts himself out there regularly to help people that need it. So
thank you.
You guys could be doing lots of things on a Friday evening after Thanksgiving. You could be Black Friday shopping, but you're choosing to carve out some of that time to be with me. So I really appreciate it. So thank you guys. Hey, let's start. It's kind of funny. And as I was kind of just mulling over some ideas of my own kind of coming into this conversation, I was thinking about like, we're going to have a post-pandemic conversation about mental health and recovery. And then I had to catch myself because we're not really post-pandemic, are we?
No. He's like, just, I'll let you go for that one first, and then I can share my experiences.
I was thinking about that today, actually, as far as, kind of what the end game is on this. And I think most people now don't think this is really going to go away. Hopefully it becomes where it's not pandemic levels of COVID, but I think a lot of people are hoping for a situation where this kind of becomes one of the regular wintertime viruses that we have to deal with, that we are able to control in such a way that it's not, the mortality rate comes down, and we've got vaccines that keep it from, being under better pressure. And so I don't know. I don't know when that happens or how that happens. I think a lot of people have a lot of opinions on it, but no, we are not out of the pandemic.
Yeah, I'm in agreement with that too, just by, how we work with our federal government, and then our treatment agencies in the field, and, how they're impacted by individuals that are coming in for services, and they'll have surges of individuals that are showing up with, COVID positive, and we have congregate care. And so we still see those kinds of things happening. Of course, then there's breakthrough cases that we're seeing, people that have had the vaccine, but maybe getting a new strain and things like that. So, I feel like we're still kind of in the midst of that. Anecdotally.
Yeah, for sure. Is this something that, from a medical community perspective, Geoff, and from a structural agency type community, Teresa, that we're looking at this not thinking, hey, when is everything going to get back to normal, but what does just things look like moving forward? We're really not going to be the same ever that we were before this happened, or is that still actually a possibility? I don't know.
Yeah, I don't know. I think that it's such an interesting social experiment on people's level with or comfort level with risk. And that's where you see just a lot of people that are acting so totally differently during this pandemic. And so for some people, their lives really haven't changed a whole lot. And you get other people who haven't left their house for 2 years.
Yeah.
And the problem is what Group A does actually affects Group B. And so, we can't act like we're in a vacuum. But I hold out hope that yes, there will be kind of a normalcy. One of the things that made this pandemic so unique is that you hear the term novel virus. It was a new virus that none of us had been exposed to, which created the higher levels of mortality with people, and just the rapid spread. And you would think that once this thing is around long enough, whether that's, I don't know how many years or decades or generations, that you would think that it becomes more like an influenza that you just have to deal with. And it's no longer a novel virus, and everybody's had some contact with it. And, I think that some of the practices that we have put in place, whether that's social distancing, or Derek, you were telling us you actually got tested before you came home to your family. Nobody did that with the flu, even though it was probably a good idea. It was probably a good idea to practice some of that stuff during influenza season. And we saw what happened with wearing masks, last year, and nobody got the flu. It was kind of nice. And I think we forget that hundreds and hundreds of people, thousands of people in the United States die from the flu every season. But we just kind of become numb to that. And I think that perhaps, yeah, we get back to normal, but maybe we keep some of the good hygiene practices that we picked up during this pandemic to keep everybody a little bit safer from some of the wintertime colds.
Yeah, I will kind of out myself in a moment of honesty that I've washed my hands more in the last 2 years than I probably ever washed my hands before. And I don't consider myself a dirty person, but it's just become so much more of an active routine that even between clients and things like that, I'll step into the break room and I'll wash my hands. And, I never would have done that 3 or 4 years ago in my office. I just would have worked throughout the day, washed my hands, in and out of the restroom and those type of things. But
Yeah, I agree. I think it, not necessarily going back to normal, but evolving. I mean, everything should be an evolution, right? And I think one thing that this has some positives that have come out of this, as much as you can say that, is that people are being more aware, more conscientious. Even, restaurants or treatment providers are just being more conscious about how they are cleaning or interacting with individuals. And one of the things that, well, not one, there's several things that came out in the treatment community when pandemic happened, was that we couldn't just stop mental health services or substance use services. And so it really pushed people into more of the technology world, which it's been around for years and we've had it available. It's just not everyone was taking advantage of that, and seeing that being such a positive avenue of communication for people. And so that has really pushed a lot of our agencies to move towards telehealth, telemedicine, which actually has helped our rural communities. We have so many people that have no transportation, and they were innovative in their ways of obtaining mobile devices and getting those mobile devices to people, like dropping them off at their doorstep, just so they had no contact, but then they were still able to maintain services. And I oversee all of our opioid treatment providers, which are methadone clinics. So those are dosing clinics. So you have to be able to dose, right? And there were a lot of federal and state regulations that provided exemptions for the rules that were in place prior to. And it just allowed for this array of service to occur where people could take home 14-day take homes that were, stable, and more stable patients were able to take home 30 days, which really reduced the impact of them having to leave work or transportation issues, and they were still able to get their therapy through telehealth. And so this actually has pushed some of at least our behavioral health world into the future, I think. And because of this, another positive impact of all of that actually has the federal government looking at their rules and regulations and like, are these archaic? And they were. I mean, they are. Mm-hmm. There were very few people that had any kind of deaths related to overdose that was related to their methadone that they were receiving. So that in itself has really opened the eyes of our federal government that oversees those types of programs, and really has allowed this opportunity to help people get access to services. So I mean, unfortunately, yes, but it's also pushed us into this evolution of what her services can look like in the future.
Yeah. Geoff, have you guys seen a similar thing happen in the medical community? I know it's oftentimes in the moments of crisis, or during an outbreak of war or something like that, you actually see a surge in innovative care and innovative use of technology and those type things. I would say in Oklahoma, behavioral health was behind the curve in a lot of those areas before, maybe not so much medicine, but is there a little bit of crossover there of things that you've seen in the medical community as far as like, hey, this actually pushed us to make some changes that we probably should have made a little while ago?
Yeah, I mean, definitely with the telehealth, that's something that at Mercy we've been talking about for probably 2-3 years. And it was always one of those things where, hey, we're getting ready to implement this, but there was nothing really, something else would come along and it just would never happen until this. And so that was certainly something that got pushed to the forefront.
Yeah. In terms of Geoff, and maybe if you're not prepared to speak to this, I guess you can make something up. In terms of like kind of where Oklahoma lands and like the national picture of what COVID and the pandemic look like how would you describe where we're at compared to like what the rest of the country was experiencing in terms of, COVID rates, death rates, those type of things?
Yeah. So, people who tend to have the fastest spread, the most cases, the most deaths are going to be areas with a very high density of people. And so, during the the worst of it, you saw places like New York City and Florida and Texas and California with the biggest numbers and the biggest tests. You say the most people, and they all live together on top of one another. And so in Oklahoma, being, just a smaller population, a lot of rural areas, we didn't see the sheer numbers or even the mortality rate. I mean, they're all pretty similar, but ours was a little bit lower. On the flip side of that, our vaccination rates aren't quite as good as some other places, but they're not terrible. And there's not just a giant discrepancy between most of the states. I mean, you've got some outliers. I think there's some areas in New England that are pushing 85%, vaccination rates, and we're not anywhere close to that. I think it's been a few weeks since I looked at the numbers, and then they break them down in so many different ways, but I think it's at least 2/3 of our folks here have at least one shot, or maybe both shots, but yeah, I don't know those numbers exactly, but we're probably a little below average nationally vaccination rate, but it's not a huge difference.
What are you guys seeing as some of the barriers to that vaccination rate jumping from 60-65% to 80-85% like you've seen in some other places?
I think there's a lot of, you can put the blame in a lot of different areas for why people don't want to do it, but it really comes down to just not being comfortable with the either safety of the vaccine or the philosophy behind vaccines in general.
Yeah. Is there places that people, and we didn't talk about this beforehand, that's me and my conversations go all over the place, so I should have warned you guys to be ready. Are there places that people could go, like trusted? So full self-disclosure, Geoff is actually my doctor, and one of the reasons that I changed and started seeing Geoff is because I trust him, and I want to go to a medical. I wasn't like probably one of those living in a fallout shelter, like I can't trust the medical community people. But honestly, there's been times in my life where I've gone to see doctors and they've told me things and I go, I don't know if I can, why should I believe you? Because I'm paying you for the service. It's probably the similar things that I hear from people that come see me for therapy, right? You're just saying that to me because you're my therapist. You don't really mean that, right? So I totally get how it would be really easy to go down that train. And so I was like, I want to go to a physician that I know personally and I trust and I know is invested in my community, because I know that he's not going to just sell me a pill because that's the last rep that came in and bought him lunch, right? He's actually going to do treatment that he believes in, that he believes is going to be right for me. And so what are resources that you would turn some of your patients to if they said, hey, I've got questions about vaccines and some of the science, and where can people go to read more about that and find some more education so that maybe they can increase a little bit of their comfort level?
The CDC.gov, they've got great resources on lots of things. I have been using their resources for decades. And so they're, everything that from travel health to vaccinations to tracking different diseases. And so there's a lot of smart people at the CDC, and unless you're going to go full-blown conspiracy theory, I don't really have any reason not to trust them. People that have trained me, all the people I respect, trust them. And so, one of the things that has made, I think, this so difficult is just like any other profession, doctors don't agree on everything. And so you have a lot of doctors who are outside the mainstream line of thinking when it comes to COVID, when it comes to vaccination, and they have a platform to speak from, whether it's social media or whatever. And I think kind of like what you experienced, Derek, that creates mistrust from people who are like, well, this doctor says this doctor says this, who do I believe? And I that's hard for me sometimes. I have to sift through the medical research to kind of, and I'm trained in statistics and how to read that stuff, and it's still difficult. So I can't imagine what it's like for someone scrolling through Facebook, seeing 4 or 5 different YouTube videos that all contradict one another, and they're all supposedly from medical professionals. That's hard.
Yeah.
I don't have a great answer for it.
Yeah, like personal experience, like I've had family and other people that have very different opinions. And, one of the things that they don't trust is supposedly media, but then they get their information from media. So when there was the conversation around that, I basically said, I do know actual physicians that have shared information that I personally know. They're Oklahoma, they're people I know here. I don't think that they would share information with me that would potentially harm me, because I think a lot of people do. Well, you don't know them. They're just these people out here, even though they may be getting their information from people out here on the dark web or whatever. But the reality is, like, really knowing someone that you trust, that is a medical professional, and having that conversation, I think, with them. Because we have Project Echoes that are out there that's providing lots of information. Sometimes I think a little overwhelming, that some people do barricade themselves into rooms because they've created so much anxiety around what information has been shared, like they've gotten too much information. So that can cause real anxiety. And that's been shown that just by having this out there, that people have had other mental health issues related to that, just because of the fear. But I think having those conversations or relationships with your primary care, or someone in the primary care area that has experienced that, and that was the conversations I had with some people. And I'm going to respect your opinion and your decision. That's yours. But I'm also going to ask and request that you respect, my decisions and my belief systems. But to have real conversations with people that have been in the midst of that and have seen what has happened, I think is really crucial. That's with anything. People don't understand people that have a substance use or mental health issue until they're really in the trenches. And then they have this, compassion and better understanding. I think that's the same way with anything that we come across. It's best to go to the source and really, especially in Oklahoma, we're all, Oklahoma based, Oklahoma, we really want to know the information from our people, that kind of thing. So.
Well, and I think one thing you said, Teresa, that I think creates it actually, I think, creates the negative feedback loop that we've seen with COVID, is that most of us want to hear information from trusted people within our community. And because of the effect that the pandemic had, it rips us out of our community, and it forces us into this place where a lot of times, even whether they're trustworthy, untrustworthy, qualified, or unqualified, we end up just listening to talking heads on a computer.
Right.
And they're not people that we have a relationship with. They're not people that we feel like we can fully trust. And it leaves us with a lot of questions. And I think that that's the ultimate, it's not a crime, because you can't put a virus on trial, right? So I don't know what word to use, but I guess the ultimate lament of what this has caused is a whole group of people that have really missed community for a year and a half or 2 years now, and are stuck having to deal with the consequences of that, right?
Sure. Yeah.
How have you guys seen that, either anecdotally in your own community and in your own circles of friends and family, or in your respected professional fields? How do you see this pandemic having affected people on that community relational level?
You want to go first, or?
Sure. I think I've seen probably the same things that you guys have seen, where, I think what breaks my heart the most, or especially early on, was the elderly population that felt like they were the most vulnerable. A lot of these people are somewhat isolated anyway. Maybe they don't have family that comes to visit them as often as they should, and then you take that away, and that was kind of heartbreaking to see. I had talked to people that literally hadn't left their house in months, and their kids would bring them food and leave it on their door, and they were too scared to even interact with them because, they thought, well, if you get COVID, you're going to die. And I think the vaccine gave them a lot more confidence to move out into society with that population. You guys could probably speak more to this than I can, but I had several people coming in who were just very anxious. They came in and said, I've been drinking way too much. I think a lot of people were working from home and not having that connection. So there's just so many different levels that, you saw community disruption and how it affected families and people in general.
Yeah, I agree with that totally. I mean, I have elderly parents, and I know that they, had a lot of fears, and we had fears for them. They, had compromised immune systems. So that is a scary, even though you can do things safely. And if you were to have, quarantined, and not been around anyone else, because my daughter had her baby, she had a baby in December of last year, and which was hard though, because we all quarantined for a long period of time because we wanted to be able to see the baby and my parents, but yet not all family members did. So it caused this kind of riff around like, well, you're being together, but you're not, you think that we're going to be infectious or something of that nature. And, but also the talk about with substance use in alcohol, I mean, alcohol was being delivered. It became an essential ongoing thing that people could then have alcohol delivered to their home. And, there was a lot of research around that. There was increased substance use, increased suicidal attempts among adolescents and adults. And so just access, and there were a lot of people that were either laid off or lost their jobs. And so they had this long periods of time that they could just partake in things that, because it just didn't really matter. I mean, they didn't really have anything else to do. And, technology just sometimes is great, but then it also feeds into some of these other things that really can lead people down these paths. And so not only during, but even there's after effects of all of that we're still grappling with, because so many people now are coming out that weren't in treatment at that time. And now it's kind of flooding the system because now they're able to come out and get treatment. And so it's just kind of interesting. So, and kind of sad. I mean, it's sad, but
yeah, one of the things that I hadn't actually, until you guys just mentioned it, I mean, I don't know if I have thought about it or if it not in these specific terms, but when people have asked me about my practice over the last year, I mean, there is no better time to be a therapist, I think, than during and post pandemic. It's like every therapist I know is on a wait list. And people are, well, why is that? What happened? Is it just pandemic fatigue? What does that even mean? And I kind of tell them that what it really did is the pandemic just exposed everything else that was probably already there anyway, that was just being distracted and buried by being able, all of a sudden I'm doing more marriage therapy right now than I've ever done in my career. Right. And I'm like, yeah, you take away people's ability to run to the gym. You make people work together from home 24 hours a day. You tell them they can't go out to dinner and they can't take vacations. And after about 6 months, you're like, I don't know if I like my wife anymore. Right. Like we need to go talk to somebody about this. And so I think what it did is it exposed a lot of areas of weaknesses in people's emotional stability and ability to be resilient. But you guys also mentioned this, it also completely disrupted people's structure, and you had people that are used to this structure where I go to work and I do these things. And even that structure can sometimes keep people well. And now they don't have that structure. They're at home for, months on end. And if they want to work at 4 a.m, they can work at 4 a.m. If they want to work at noon, they can work at noon. But as long as they get stuff done, nobody really cares. And all of a sudden they're just left to their own vices, and their own mental and emotional fatigue, I think, just really takes over at that point.
Yeah, I think it's how you look at it and how you cope with that. Because, you know, some of those things can be good, but then if it disrupts and like really starts impeding what your actual performance is, then that becomes the problem. Because I mean, I started working from home oh, pandemic, we're going home. So getting used to not getting up and going out of the house. I mean, I had to like purposely make myself get dressed as if I was going to work, and I made sure I had to ensure my setup was outside of my bedroom or the kitchen, like it was like a place I go to, because having that social interaction daily, like we would pop into each other's offices and have a conversation and do some, you know, troubleshooting or just coming up with ideas, and that wasn't available. And then also because of technology being so available, I had 8 hours of Zoom meetings. Like everybody's like, oh, you've got time. It's like, I don't even have time to go to the bathroom. Wait a minute, give me a second. And so it was just such a huge shift. You didn't have that 30-minute drive to work or the 5-minute, you know, walk to a meeting. It was constant going all the time, but also just readjusting to not having that, like you said, routine of going into work, and how does that affect your mental health? And so definitely.
You know, Geoff, one of the, I think, kind of running themes is just that there's a lot of value in community and normal life and being able to do the things, you know, that we know keep us healthy, whether that's the gym or religious activity or self-help meetings or AA or group therapy or whatever that is. At this point in this like COVID process, what are the things that people should be thinking about and considering in terms of like evaluating that risk and behavior kind of teeter-totter? Like, what are the things that are going to reduce the risk and help them return to some of these normal things that we know are good for them?
Yeah, I think when we look at ways you can reduce just basically your risk of getting COVID, probably looking at the number of people you go to that you're going to be around. You know, if you're in a group of 10, your risk is going to be less than if you go to a Foo Fighters concert or in 100,000 people or whatever in a football stadium, or so just the number of people that you're going to be around. But a lot of times you can't control the people around you, and so all you can do is just try to be safe yourself, and that's going to be if you are in a high risk area, masking. It's not none of these are any kind of foolproof ways to keep you from getting COVID. They're just an added layer of protection, right? And so we mentioned the hand washing thing. We mentioned trying to social distance. We mentioned masking. Now that the vaccine is available and being widely used, I think that has given people a lot more confidence to be around people. So again, it's not anything that's going to keep COVID from coming around, but the difference that the vaccine has made has been to make this a much less scary virus. So for instance, I haven't looked up any kind of national numbers, but we get our own hospital group's numbers monthly on COVID and how that's been. And so since I don't know the latest ones, but probably May through September, we've had about 5,500 people in the hospital with COVID. 500 of those have been vaccinated. And so you just think, okay, if you can extrapolate that out to more people being vaccinated, then you might still get COVID, but your chances of going to the hospital are way down. So basically, and the numbers are pretty much across the board in a nation like that. 90% of our hospitalizations with COVID now are non-vaccinated folks. There will continue to be new strains. There's a new strain now out, originating in South Africa that everybody's kind of scared of. And that's just going to continue to happen. So even if you're vaccinated, you're going to get COVID. But your chances of getting really sick with COVID are way down. And so that gives you the confidence to get back out into society and practice some of these other safety things that will further keep you safe. So,
yeah. Is there, and this might just be a simple yes or no question, I don't know. Does it really matter at this point, like which of the 3 vaccines people are interested in? I mean, they all seem pretty widely available here in the Oklahoma City metro area, at least. Research has all said that, hey, they're all great, take, spin the bottle kind of deal.
yeah, I mean, they're all effective. It looks like the COVID, the Pfizer rather, and Moderna are probably a little bit more effective than Johnson & Johnson. It's not a huge difference, but it's a big enough difference that if I were telling somebody, they want my opinion, then I'd say get Pfizer or Moderna.
Yeah.
They're not a whole lot better, but they're enough better that it's worth it.
Yeah.
And there's going to be some others coming to market. I know AstraZeneca is working on one that is supposed to be even better. And so what we're seeing now, I mean, it will just continue to improve with vaccine quality as more people, research this and
it seems like the direction this is heading, that we can expect COVID vaccines to be really similar to flu shots, where we really need to get to the point where that's just a regular routine in most people's preventative health care every season.
I mean, that's what it looks like right now. I mean, who knows what happens in the future, but it kind of sure seems that way. Yeah. I mean, I guess the difference right now is we're not, people who make flu shots, they work on that thing year round. And the way the flu shot is seasonally spread throughout the world, they're able to look to Asia and predict with a little bit of accuracy what strains we might see and sort of tweak the flu shot every year. We haven't seen that with any COVID vaccines yet because we haven't seen enough variants that are popping up. But hopefully if that becomes a little more predictable, then they'll be able to make the vaccines even that much better.
Yeah. So just, I'm going to summarize, Geoff, just kind of what I heard from you. It's good to be concerned about your risk, and it's good to be cautious at this point in the pandemic, but you can do things to mitigate that risk. Vaccines are definitely on that list of something that you should explore with your physician and explore getting, but also continuing to monitor, mask wearing, hand washing, appropriate social distancing, and how many people you're around is definitely something that people should still consider and still be mindful of and still be thinking about. Teresa, in terms of helping people get back on track in mental health community, in recovery community, what are some of the things that maybe you could offer? Like, hey, if I just kind of made a short list of like 3 things that, people should be mindful of and people should be doing to step back into taking care of their mental health and taking care of their recovery, what are some of the things that you're seeing regularly or that you're thinking about regularly?
Well, I mean, first off, I kind of want to make sure that people fully understand that having a substance use disorder does put people slightly at a higher risk. And so taking those precautions that Dr. Hoover mentioned is very important because of that. I mean, it's a comorbid issue, and people are more, their immune systems aren't as well, and that's lifetime and more recent. More recent is going to have more potential of negative interactions or results of having COVID or higher risk of getting COVID. So just keeping that in mind. Also just noting that those things are still available. I think there was this misconception that everything was kind of closed down when COVID occurred, and so that people couldn't get services, which is not true at all. And knowing what questions to ask. If you do still fear about coming into the agency, most agencies, well, I should say all of our agencies are still providing telehealth services. Medicaid expansion has occurred, and Medicaid is paying for not only telehealth individual, but telehealth family and group therapy, which has never been covered before. So really knowing those things are out there and available to people, and to not be afraid to ask those questions when they call and ask for, services not to be afraid of congregate care or residential treatment. There are precautions put into place for individuals that do have tested positive for COVID. They, separate them. They have lots of protocols in place now to really assure that it doesn't spread to other individuals within the residential care setting. So really kind of reducing the fears of what, initially it had occurred in the previous year has really, everyone's put in these policies and protocols to really help individuals feel safe and comfortable for coming into services either in the outpatient or residential setting.
Yeah. Excellent. Treatment's still available. Treatment's been available
Yes.
this entire time. There's additional precautions put in place, and payer sources are paying for telehealth services at rates that we've never seen before. So excellent. Hey, thank you guys just for taking some time out and being willing to have this conversation. Thank you for the conversation, but also just thank you for what you do for Oklahoma City and for the state of Oklahoma. I know that I was like kind of facetiously teasing you both about your humility, but like both of you actually do a lot of things for people in the state, in Oklahoma City and at large. And so thank you for your, commitment to care to your patients and to the people of Oklahoma and for everything you do. And thank you for joining me and having a little bit of a talk.
Thank you for inviting me.
Yeah, thanks, Derek. Appreciate it.
Hey, everybody. Hopefully you got some valuable information. Feel free to reach out to Parents Helping Parents with any questions or comments you might have about anything that you heard. We'd love to put you in contact with either of these people or with treatment centers or agencies or hotlines or places that you can find more information. We just want to make sure that you get all of your questions answered. So everybody stay safe and hopefully have a wonderful holiday season.